Hello, I'm Dr. Laura Walton, and I help people who are feeling stuck with perhaps mental health issues or maybe lifestyle issues that they're struggling to change. And I help people to understand what is going on for them and work through some of the ways that they can make changes and maybe live more fully in the way that they're wanting to live. But I know that if you're thinking about meeting me or another psychologist or therapist, sometimes the word psychologist sounds a little bit scary and you might not know exactly what that means. And it can sound a little bit like I might be quite judgmental or, kind of dissecting what you do. So I appreciate that just sounds a little bit overwhelming sometimes, so I thought I'd make this a very short video to just explain a little bit more about what a psychologist is, especially what a clinical psychologist is, which is the type that I am. So first of all, it represents a more kind of academic study. So we're not medical doctors. We haven't had medical training like a psychiatrist might have done. We kind of would, especially for me, start with a psychology undergraduate degree and perhaps other psychological studies, and learning about human behaviour and why people do what we do, how we feel, and how humans develop and that sort of thing. Following on from that, to become a clinical psychologist, it's actually a doctorate level training. So that might be 3 or 5 years of doctorate level training. And that doctorate's really all about trying to, understand how we can use that academic knowledge, that understanding of psychology and why people do what they do, why we feel certain ways, and how we react to difficult situations, to understand what all of that kind of theory, and then look at how we can apply that when working with actual people in their real lives, because theory and real life, they're connected, but they're different. So that's why we have a whole, 3 to 5 year course on learning how to do that. And in that course, our training covers an awful lot. We cover training across the whole lifespan. So we study, issues that babies have all the way through to older adults. And we also really have a lot of focus on what normal life is like. For us, it's not really about finding disorders or trying to kind of say that people are kind of wrong or broken. It's actually about, most of the time, in fact all of the time, I think, when people are having difficulties, it's completely understandable when we really look at what's been going on for that person. So we look at human development and we understand human relationships and how people interact and communicate, and we have a very kind of broad training within that. And so taking that training, I want to kind of maybe tell you a little bit about how I think of how I work with people, which is, yes, that's like 7 years of academic and practical training, and overall I've got maybe 10 to 12 years of actually working with people in this field. But taking all of that kind of academic knowledge, practical experience, I kind of think of it like I'm going to take all of that and kind of funnel down to find out what I need to work with you. So I'm bringing in that kind of theory and my clinical experience to your issue, but you're the one who's got that experience. You're the person who understands what's been going on for you and can describe that. And so you're bringing in that experience, and it's really important for me that I'm not trying to tell you what's going on for you. I'm trying to kind of bring my side of what I understand about human psychology, filter it all down so that we only get what you personally need, because you may not want to do 7 years as learning about psychology. I just want to pick out the bits that are going to be useful to you, but we're going to do that by me listening and finding out your experience of life and this particular issue that you're wanting to work on. And for me, it's very, very important that it's that your experience is actually probably more important than all of this theory, and it's about us working together to kind of help you ultimately with the issue that you're having. So again, I appreciate that there are lots of different psychologists and therapists out there, and it takes time to work out who's the right person for you. So I tend to offer a kind of short free call so that you can just meet with me for 10-15 minutes to think about whether I might be the right psychologist for you, and you can book that with the link that's next to this video. Or if you're still not sure and you have specific questions you want to ask, you can contact me via the website, which is 2 Clicks Psychological Services.